Welcome into Rounding the Bases Live, presented by Enterprise Bank and Trust. Happy Monday, everyone, and hope that you all had a good weekend. It's a nice hot one here in Kansas City, and my hope is that you continue to stay safe, that you are social distancing. I know that's a discussion that we're still having and still needing to remind people of. We'll actually have a little bit of that discussion among other things today. Before we do so, do want to thank, as always, my partners at Enterprise Bank and Trust, hashtag no stopping you. It's actually over there today, nice and healthy and safe from that standpoint through the drive-through, and doing a little bit of business over there at Enterprise Bank and Trust. I know that it is time to order more ground beef, Wagyu beef, for the Goldberg family. Casey Cattle Company, they're up in Weston, Missouri, veteran owned and operated, led by former U.S. Army Ranger Patrick Montgomery. They deliver to all 50 states. Just check out their website. If they're out of anything in terms of stock, check back on a regular basis. Usually seem to reload on Tuesday mornings, and that's what I'm going to do tomorrow morning and get that order in. Probably need to get some of those award-winning hot dogs or bacon cheeseburger brats too. So check them out, CaseyCattleCompany.com, or on social media. And Wednesday, 2 days from now, is Wine Wednesday at JJ's Wine and Spirits, southwest corner of College and Antioch in Overland Park. So hope you'll go and visit them. They've got a phenomenal selection, excellent staff that'll help you with your selections. So check them out, JJ's Wine and Spirit. Also, you can see their Facebook page if you want to see a little bit more of what is going on. I'm excited right now to be joined by my guest this Monday on episode 59, Maria Evans. We had a chance to meet, a little conference call last week, get to know each other a little bit, and there's a lot to discuss in terms of what is going on in the world, and so we'll get more to what that is regarding Maria and her expertise. But she is a certified adult gerontology practitioner, which are too many big words for me to explain, because Maria, I don't know that I told you this the other day, my medical background is like this. I was not a good science student. I know you put in all of that work. Before we get into antibody testing and what you're seeing in the world of COVID-19 and reminders that we all could use, tell me what a certified adult gerontology practitioner is, and did I even say it right?
You did.
That's good.
Well, thank you for having me on. I really appreciate us being able to use this platform to kind of discuss COVID-19 and just some things that are happening in the current events. An adult gerontology nurse practitioner I actually can take care of patients and see patients from the age of 11, 12 to the end of life. If I was a family nurse practitioner, then I would be able to care and provide care for patients basically 0 to the end of life. So that's basically in a nutshell.
Okay. And I know that you do a lot of things, and you're involved in wellness, KC Wellness. And, when we connected, you guys were among the first here in Kansas City to be doing antibody testing. Now I know it's available in many other spots, and you guys have that experience from having done it the last 6-8 weeks or whatever it is. So let's start with this, because I think we all know about COVID testing, and there's more of that available now. We are all hoping that a vaccine will come, and I suspect that's going to be quite a while. I think I have all of that correctly. But for those that don't know, let's talk about antibodies and antibody testing. What is it?
So first of all, let's identify or define what antibodies are. And antibodies basically it's the immune response, our immune response, when we are or have been exposed to a virus or a bacteria. So the antibody response is helpful for immunity. So that's why it's such a big deal right now, because of course with the COVID-19, there really is a lot of things kind of up in the air as far as long-term immunity for us.
Okay, and so we obviously know that we need more information. I think the scary thing for me is, we so often turn to our medical professionals, your doctor, your nurse, whoever it is, and say, okay, what do I take for this? What do I do for that? And it seems to me like whoever I ask in the medical field has a different type of answer, which tells me that if they're all professionals, and the people I'm asking are friends that I hold in the highest regard, that are very accomplished, that they don't know all the information yet. Where are we with that?
I agree that, yeah, it really is. And like it is, it's a novel coronavirus, right? So we don't really have a lot of that data. So that's why it's so important for us to do surveillance, test. That way we have some of that data for the scientists to be able to determine what this is going to look like for us. Right now, we just don't know. There's so many different, like you said, you can speak to friends of yours that you have a lot of respect and regard for, and we just don't really know. And that includes us here too in Kansas City.
So what have we learned so far?
We've learned that the majority of the people that we tested, as far as the antibody tests, have come back negative. So what that means when we were doing our testing was, and again, let me clarify that we were not doing symptomatic testing or the nasal swabs that you're seeing that people are actually getting. So the antibody testings were basically to determine, have you had a recent exposure or did you have a past exposure? Of course, with the time frame, a lot of people wanted to know, especially during March, February time frame, they wanted to know because they were sick. So we did do the testing, but a lot of them did come back negative. So what does that mean for them as far as, going back to work or being able to do things that they would feel more comfortable? It allows them to have at least a little bit of information, right? But again, it's up in the air because we just don't know what the antibodies or the immunity to the coronavirus is. So we still need to social distance. We still need to be careful out in public for sure.
Yeah, and I want to hit more of that in a bit because I think you and I talked a little bit the other day. It's a little disconcerting to me to see how at ease people are becoming. I get it, by the way, too, because, we want to get back to normal life and what we're comfortable with. But in terms of coronavirus, in terms of antibody and all that, you said something a little while ago that I knew, but say 4 months ago, 3 months ago, I didn't know. I'd never heard of a coronavirus before. Now, you in the medical field, of course you have, right? But to me, remember at first we heard coronavirus, and then it was COVID-19, and for a layman like me, and I heard from other friends that were saying the same thing, it was like, well, wait a minute, is it a coronavirus or is it COVID? And we came to understand that COVID-19 is what labels this specific coronavirus. I don't think a lot of people, maybe they did, but certainly I didn't ever hear or use the term coronavirus before. But yet we've all had a common cold or some form of a coronavirus, right?
Yeah, absolutely. Or SARS or MERS, or yes, we have. And, we've been able to maybe control some of those, but the common cold, we don't have a vaccine for. So we have had exposures to various types of coronavirus. This is just a new novel coronavirus.
And if we could just know that this is, as serious or not as serious as a common cold, I think we'd all feel really good. Obviously, the common cold doesn't have, and I guess it has the ability ultimately to kill someone, but it's not.
Not like
obviously not like this, right? And we have a vaccine for the flu, so we know how to potentially. I know there are different strands of that, but how much? I mean, when I've heard this, not compared to a cold, but when I've heard it talked about in the way of, we've all had colds before. How many times have I asked, whether it be a pharmacist or a friend, hey, what should I take for this? What should I take for this little cough? Or what should I take, for this congestion or decongestion, whatever? And you can get a million different answers.
Mm-hmm.
And so I sit there and I wonder, well, is that a little bit of not where we're at in terms of the coronavirus, but might there be, or the COVID-19, might there be any number of answers to this?
There might be a number of answers. I know that that there are a lot of studies right now for medications that we have in our arsenal right now, potentially helping with COVID-19. So we just don't know. And I know that there are probably 100 plus vaccine studies that are currently being done also. So we just don't know. And unfortunately, that's going to be the pat answer is we just don't know as of yet. What is it going to be as far as, is it going to be a combination therapy? Is it going to be a vaccine? We just don't know. I wish I could say, you know.
Well, I think we all wish you could say, or someone could say, and that's
Yeah.
where we're at, right? And we're talking about brilliant scientists, not just here in the United States, but all around the world.
Yes.
Typically, in finding a vaccine, and if and when they do that, it could be life changing, right? For so many. And you think about some of the big time vaccines, and think about the history of polio or things like that. Everything changed once that was discovered, but this doesn't happen overnight.
Right.
And once it does happen, still need to make sure that it's safe and tested and all of that. I mean, typically to find a vaccine, I don't think most of us are involved in that process. Is that typically 6 months, a year, 2 years? I'm asking you a very generic question that I know that there's probably a lot of specific answers, but that's not an overnight thing, I guess, is my point.
Yeah, it's not an overnight thing. And I'm not an immunologist or an epidemiologist or any of those that actually, I don't work in clinical trials. But I mean, normally it might take up to 10 years for us to get a medication on the market.
Right.
So there's extensive studies and testing that's done. But of course, we're trying to get, or the medical field is trying to get that vaccine out there much quicker, of course, than 10 years. So no, it isn't an overnight thing. And that's unsettling. So right now, how do we help patients or people in the community be able to adjust to the new norm at this point and keep them safe? That's really our goal at this time.
Maria Evans, KC Wellness Center, is joining me, and got a question that came in. My friend Jennifer Dehan knows everyone, so I guess she knows you too.
Jennifer, yeah. Hi, Jennifer.
How has transitioning to telemedicine affected your patient care, and what creative things are you doing to provide the same great care? It's a phenomenal question, because we are now all becoming very accustomed to the term telemedicine. That was not something, I didn't tell you this, that was new to me, because my wife for many years was working in telepractice for speech therapy. And she had done that for about 6 years, took a year or two off. She's back in again right now. And the ability to deliver speech and hearing care to children in school districts that are maybe more rural or don't have as big of a staff. And so it's a phenomenal thing. It's not brand new, but it's obviously evolving. How has that changed? And especially in terms of right now with COVID-19. And with having to, in the past, it was always, hey, if you're sick, go into the doctor's office. And now it's, hey, if you're really sick, we got to be careful about how we go about this. How has the telepractice end of things affected all of that?
Well, we stumbled through it like everybody else, because all of a sudden everything was good. And then all of a sudden everything was kind of closed down, and we had to really kind of scramble to get onto telemedicine and then really learn how to use it appropriately. So our patients have been very patient with us as we've actually gone through this learning curve. So we felt it was very important for patients to, one, either do telemedicine. We've also offered patients to come in practice, of course, with the proper face covering and a mask, as well as the providers are also in masks. And then we also are providing patients the ability to pick up injections as far as what we do in our clinic. So we've tried a myriad of different ways, or also mailing out the things that they needed. We've tried a myriad of different ways to try and keep their care uninterrupted as much as possible. But, like everybody else, there has been some interruption, and there needs to be a new way of actually kind of accommodating patients and seeing patients and providing their care. So telemedicine has definitely evolved in our practice, and I think will remain.
Yeah, and with all the different things that you do at your practice, a lot of them, obviously, they need to be seen in person, right? I mean, when you're starting to talk, and you were telling me about some of the different things in terms of hormones and micronutrient infusions and hormone replacement, all those different things. You obviously can't do that through telepractice, although I would imagine that the communication end of things and a lot of what might come face to face can be done in that. I'm curious what type of reactions you have seen and heard, whether it be face to face or like this, because these last few months have been scary for everyone in some form or another. And this is one of the things that I've talked to people about. I don't care what profession you're in, how much money you make, where you live, what you believe in, by the way, either. I mean, not everyone is taking this as seriously. It's still in some form or another, whether you believe in it or not, it has affected the way we go about our everyday lives. What have you heard from people? Because I would imagine it's across the board.
Psychologically, emotionally, I've heard a lot from patients, especially with us being at the stay-at-home orders and us not being able to see friends, families, socialize. It really has impacted people where I've seen more depression in regards to our patient population, more anxiety. Inability to sleep for them, and also weight gain, a lot of weight gain. We've done a lot of eating through this. I think that's just something that we've used as a source of comfort. So we've really had to work with patients and being able to, one, reach out to them and make sure that they're doing well. And then, of course, provide for them kind of that shoulder and being able to help them get through this time. I mean, it's a really tough time. And as we open, it doesn't relieve that. It actually has increased some of that anxiety. Even though we're happy to be out and going and doing things, it also is, just like you said, that we had a conversation last week. It does create a lot of anxiety because, one, you realize, wait a second, there's still a pandemic, but yet it's really nice to see people out. So it really is just, it's a tough time.
Yeah, it's unique times too, because when you add in all the protests going on, I think you and I talked a little bit about that last week, and we certainly had a phenomenal discussion on this podcast with my panel on Friday about racial injustice. I'll continue to have those talks too, but it's an interesting time in the sense that we really have been told not to be in groups. And if we are, to have masks on, and certainly outside over inside. However, when you start to have that many people gathering, that really questions things. But then there's the moral end of, wait a minute, is this the right thing to do for a much bigger cause than any virus? So there's just so much going on right now, and I can't imagine. I know for me, I'm going to do what I think is best. But the amount of pressure that people are under, especially those that have to go back to work, that may not have that luxury. I know I'm getting into a whole nother discussion here, but this is really, from a psychological standpoint, you talked on psychological, this is really presenting people challenges that maybe they've never dealt with before. And I'm sure that you're hearing so much of that, and I'm sure this is all something that you're having to process yourself as just a normal human being too.
In a small business, right? So all small businesses are being affected. People financially are being affected. Patients that have had successful businesses are now in a different position. So it falls under such a large umbrella. It's not just one thing. And again, like we had spoken about, the protests add a whole other factor, right? So all of these things are just bubbling up and creating a lot of anxiety and instability in a lot of people. And I think that for some of our patients too, they've been a little bit to have a hair trigger, I should say, for emotions, either anger or tearful. So it's like you said, it's unsettling and it's a unique time.
Well, and we all want connectivity.
We all do. Yeah.
Even if we're introverted, even if we're quiet, I think most people would say that I'm not introverted or quiet. Hey, I need my quiet moments, by the way, too. But those quiet moments, even if you don't like a big crowd, typically don't involve 8, 10, 12, 14 weeks at a time of isolation. And so, I think that's one of the challenges, certainly, that we have. And as we get back into work, I know I want to get back to some of the antibody stuff. Yeah. And where this is going in the future in a moment, but I just want to circle back to some of these what to me seems like basic rules: social distancing, wearing a mask in public. I get, and I will stay out of. I do my best to stay out of politics in everything that we do, and I don't think I have a career in politics. That's a good thing, but I
Neither.
do think that for whatever reason, politics, media, whatever you want to say, this has become to me too political of an issue. I think that we could debate what is the best thing for everyone in terms of economy, health, where that balance is. That I think that could be a productive debate. But when we start talking about wearing a mask or not wearing a mask is a sign that you represent some type of ideology or political view is completely idiotic to me. If people want to or feel the need to go out and protect themselves or others, that's common sense. Why are masks and the social distancing at this point, as we just are trying to get comfortable, why are they still so important?
In reducing our exposure, you mean?
Yeah.
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 Well, as they've stated before, of course, the droplets, they're even discouraging us to be close together and singing. Any of those droplets are also can be a contagious or a form of being able to infect other people. So it is important for us to have some kind of a social responsibility for each other. I don't understand this debate or the issue. As far as having to wear a mask or not wear a mask. I just feel like I'm going to respect your family and your health, and I would like the same done back for me. But of course, it is in part for, or mostly because of, we don't want to transmit the coronavirus. So social distancing, being able to not be in large groups in close proximity together, and also making sure that we have a face cover doesn't allow for those aerosolized or droplets to expose other people that might be immunocompromised, your loved ones, my loved ones. The scary thing about coronavirus is that there's no pattern. It just seems like you could be a 30-year-old healthy person and die from it, or a 98-year-old and survive it. So there really is no rhyme or reason, or be a 7-year-old and be infected with it and pass away. So it's just very, we just have no real rhyme or reason.
And I think one great way to think about it too is that it's not really about you. We got a email today from my son's high school football coach, and they just started this morning their kind of summer workouts. Very very well mapped out, and when they show up early in the morning, temperatures being taken, they're being split apart so they're not too close to each other. There are contingency plans in place so that if they have to call off a practice the morning of because thunderstorms are coming, then they're calling it off because they won't let them go inside. And he made a comment in one of the emails. Let's see if I could call it up here. But he basically said, look, I'm going to need more help from you as parents to help communicate my message because I can't get all these kids into one big huddle. And here's what he said. He said, we want to make sure we are thinking and taking care of our players who might have elderly grandparents at home, family members who might be high risk, and so on, so we can welcome back all of our players. Every single one of those kids might be totally healthy, right? But it's not all about, and we've heard kids are less prone to this. I think the studies are still out on that. But all it takes is one at-risk relative or friend to really make this extremely dangerous.
Exactly. And change your world and my world, as far as our family members or our loved ones. Absolutely. I think it's our responsibility too, as we start to open up and as we start to be consumers again, to really kind of ask those questions. If we're going to a restaurant, how are they doing this? I know that it's all over the news right now, but as we go in, I think we do, or before we go in, we need to find out what they're doing as far as social distancing and keeping us safe. And I think that is a completely appropriate way to go.
Okay, let me get back to the antibody stuff just a little bit before we wrap up. And I know that you guys had offered that for a while. You're not doing that at the moment, but you certainly had an opportunity to observe, to learn. Who, in your opinion, and now it's becoming more available. I know that Casey Wellness was one of the first in the area to be offering it. Who is someone that should be looking into something like that?
So I think that anybody who, one, if you're going back to work, you can certainly make a better decision. If you've had that, if you've been sick recently, or March, February timeframe, if you want to have an antibody testing, you can certainly have that testing done. Also, just to know that if you have the antibodies, again, we don't know what that means right now. It's too early to say what that means as far as what our immunity is. But they can certainly help out in different ways by donating blood. So it's a myriad of different things. Also, as we're getting our antibody testing, what does that mean is we're going out in our communities. So it really kind of helps for you to make a better and a well-informed decision.
And then I guess as all of that information is collected,
yeah,
it helps lead into the bigger picture, I assume, in terms of specific communities or even nationwide and worldwide.
Absolutely. Surveillance is important. So we started early on with the antibody testing because we wanted to really lessen the burden on our either our health department, our urgent cares, our ERs. So we wanted to provide that because, of course, we weren't able to go on the front lines and work in New York or California, or, and then also preparing and potentially Kansas City being a hot spot. So we really wanted to provide that for our patients and the people in our community to help with the surveillance process because, like I said, we weren't able to be right there at ground zero, so to speak.
Good process or a good experience for you guys to be a part of that?
It was a great experience for us to be a part of that. We really wanted to give back to our community. We felt very strongly about that. So I think this really helped us to be able to do that, even though we're no longer providing it. We feel good about kind of stepping back because as more tests are being done in the Kansas City area, we feel that more test sites have popped up. Patients have more information as to where they can get tested. Before, we really didn't have that information. So we felt that it was our responsibility to provide that for our community.
All right, so information that has been provided, obviously people can go find that elsewhere. It's also, I think, great that more COVID tests are finally available, and so that obviously has something to do with the rise in number. I've always said that the rise in cases may be more related, I'm not the one saying it, but may be more related to the available testing. And so that's good that we can obviously see what is going on with more people. The bigger question is, what percentage of those people are having to be hospitalized or go on ventilators or losing lives, right? I mean, that's but the one concern, not the one, but I think that one of the big concerns right now that so many people, including myself, have, Maria, is that we are seeing spikes again when we were told that, I don't know if we were even told, but the assumption was that this thing would return again in the fall because the warm weather would certainly help to get rid of it. But yet you said before that we haven't figured out patterns yet. So how concerning is that suddenly this sudden spike here in the middle of June?
No, that's very concerning. But then again, you made a very good point was hospitalizations versus increase in testing, right? Increase that we've had more tests available for our communities. So I absolutely agree with you on that in regards to, I think if we have more hospitalizations, more ventilated patients, more deaths, then that's absolutely more concerning than I shouldn't say more concerning, but then just more positive cases because we have more testing. So as we move into the fall, the concern is, of course, for the flu season, right? So, and coupled with the potential for the COVID-19 as well. So you have two viruses that will affect the respiratory system. So that could be just awful.
Right. So have both of those potentially at the same time. And we know what flu season can look like. And I think this all sort of started, at least it got to its bad levels beyond flu season. We haven't really had the two of those coexisting, in full force at the same time. And so, it'll certainly be interesting to see what happens with that going forward. How about for you guys at Casey Wellness Center? And I know I mentioned some of what you guys do, but tell my audience a little bit more of what you do and how business is starting to come back? If it is, because I think that for you, and I'll give this example. I go to my chiropractor. She's actually been a guest on the show, Dr. Michelle Robin, on a fairly regular basis. And that, like so many things that I was doing, just stopped.
Yes.
And, and it became a what do I absolutely have to do versus what can I live without? And while my body didn't love that I was living without it, I could live without it. I went back in last week, got an adjustment, did so with a mask. She had a mask on, and it felt very safe. That's a process in terms of logistics for any small business owner, but also in terms of security, feeling safe, feeling there's a trust issue too in terms of that. So just tell me a little bit about how that has worked for you guys and some of those services that you offer.
So as far as our business kind of coming back again after everything's kind of reopened, we've definitely starting to see more patients coming in. Again, as we started that phase 1 opening process, we still allowed patients to have a multifaceted ways of being able to follow up or get their medications or to get their services completed. But now we're pretty much open for business, and patients are coming back. It's taken a couple of weeks. It was kind of a slow start. You can kind of see it amp up. And I think that as people are going out more, maybe feeling more confident, they're coming into the practice. And also what we're doing is everything is being cleaned after each patient. Mm-hmm. We're using social distancing among our own employees while we're in the practice. We have our masks, we have our gloves. So we are very diligent in keeping our practice clean, and then also being mindful about keeping us and our patients safe. So as far as what we do hormone replacement, we do weight loss, we do micronutrients infusions, which is high-dose vitamin C infusions. So we do a number of services that you could still do, which we were lucky to do. But like you said, you kind of had to pick and choose, right? If you were a person that was laid off or furloughed or lost their job, you have to kind of pick and choose what you're going to do and what's important for you. So we did kind of see that go down as far as our patients coming into clinic, because they did have to make those choices. But we did try to help them as far as price points, being able to give them a break, especially during this time. They've been longstanding patients of ours. We appreciate them. And of course, we want to do what we can to continue their care.
Well, I've said it over and over again. People will remember down the road, if not right now, how they have been treated during this pandemic by those that they do business with, those they have relationships with. And so when they feel like they're being taken care of, those are the emotions and the feelings that will be remembered. And so kudos to you guys for doing that. For anyone that is looking, the website is up on the screen. KC Wellness, it's an integrative medical practice in the Northland here in Kansas City. And we'll say this for a final word. We've talked quite a bit about Antibody, but it doesn't hurt to go over this one more time, Maria. The fact that we're not out of the woods, not even close to it, and just a reminder that we still need to be able to do our part in terms of everyone being a little bit careful here as we reemerge into society, because that's happening. I mean, we're not. I don't think we're going to be sitting in quarantine and isolation, day after day, week after week, month after month. My hope is we don't get back to having to fully do that, which really was always about flattening the curve in terms of the hospitals and
exactly
and beds, right? So now we have to figure out. You tell me if I'm figuring all this out right. Now we have to determine how to sort of let all these worlds coexist, meaning getting back to normal while not acting like we did before and being able to be out and safe.
Which is unfortunate, right? Because there's a handful of us that are still using and are still going out and behaving like it was before, and those of us who are not. So that is the real challenge for us, is to be able to educate people to understand that we have a responsibility to each other. So
it's not a freedom thing. It's just a matter of being safe and doing what's right. Yeah. And essentially getting us back to where we have more people working, less unemployment. I'm sitting here waiting to get back to work for baseball next month, and I can promise you, I've just heard of some of the discussions that they are dotting every I and crossing every T in terms of the health standpoint and how to go about things, best practices. That's a different discussion on why they can't all get on the same page in terms of money. I will not ask you to deal with that one. I'll deal with that on my baseball show. But
Yeah.
Regardless, everyone wants to be healthy and safe. I think that we could all agree on that one. So, Maria, can't thank you enough for your time, for your insight, for everything that you are doing, and really enjoyed the visit, getting to know you, and for being able to tap into all your expertise.
Thank you so much. I appreciate the time.
All right, hang tight for one sec. That is Maria Evans. Really enjoyed visiting with her. And I want to wish you all a great, healthy, and safe week. And here we are, middle of June, June 15th. Nice and scorching hot. Starting to feel like we're into that July and August weather, at least here in Kansas City. So stay safe, everyone. Thanks to JJ's Wine and Spirits. You can look at them on Facebook or go visit them at the southwest corner of College and Antioch. 15% off bottles of wine on Wine Wednesday. Casey Cattle Company, their social media feed always has the updates, and you can go to their website to order. They deliver to all 50 states. Veteran owned and operated, and it is Wagyu beef. It is spectacular. Thanks also to Enterprise Bank and Trust, #No Stopping You, and to all of you for watching. Hope you'll share this with your networks, and I'll see you back here tomorrow for another edition of Rounding the Bases Live, presented by Enterprise Bank and Trust.